Welcome back to The Sensitivity Doctor. Today, I've got a great conversation with Dr. Danna Bodenheimer, who I found actually on socials because I was obsessed with a post that Danna had done on complex trauma. So I'm thinking we're going to have this conversation just about that. But it turned into this really enriching, awesome conversation about insecure attachment and avoidant attachment, and how with complex trauma, you can finally figure out ways to not heal, as we said, but ease the discomfort of what it's like navigating relationships with these attachment styles. So if you've been struggling with dating to just acquire info on people and not actually connect, if it's hard for you to say, I love you, we got you. This is such a great conversation to help you make sense of all of that and to figure out how you can start moving forward and connecting and actually enjoying these relationships more. So I hope you enjoy. I'm definitely going to have Dr. Danna back so we can talk all about neurodiversity, which we both obviously love to chat about. And I hope you enjoyed the episode. So everyone who's joining us, I'm really excited because Danna is someone that I reached out to because you put up a post that I really appreciated about CPTSD. So before we launch into that, can you tell everyone listening just a little smattering of like who you are and why you're even talking about this topic?
Sure. I'm Dr. Danna Bodenheimer, and I'm a therapist and a practice owner of a fairly large practice in Philadelphia. And I've been trying to make my presence a little bit more known on social media. I do a lot of writing about therapy. I do a lot of supervising. And sometimes things just don't sit right with me in the field. And so it's been great to have a platform to sort of speak out about that because I feel so little alignment with so few people.
Yeah.
So yeah, I've been a therapist for 20 years, and you see these trends come and go, and then there's something about the person that's lost in that kind of rapid fire of we do it this way now, or we define things this way now, or it's like an idea that's 20 years old is like dated, and it's like it's just not actually true. So I try to like get back to the basics of all of this and like hold some complexity around it. And my main areas of interest are neurodivergence, working with queerness, and sort of challenging norms so we can get back to the relational aspect of psychotherapy.
Awesome. And what you just said a little bit before, saying that there are things that just don't sit right with you that you speak up about, that was exactly why I reached out to you, because you had a post about complex trauma that I loved because you were kind of asking questions about what are our thoughts on this? How are we treating this? How are we mistreating this?
Right.
What are ideas that we're kind of just missing the mark on when it comes to complex trauma? So here is your platform. Go for it. I would love to know what you think we're getting wrong with complex trauma. And maybe it would be good to start with what your definition, it's whatever you define complex trauma as.
I define complex trauma as a form of ongoing trauma that happened in early childhood that left an imprint on the person to the point at which their personality and the trauma become pretty united, and that it's really hard for the person to find an authentic sense of self outside of the intrusion of the trauma, because the trauma was so constant that the intrusion now is equally constant. I think it results in a huge amount of self-doubt, shame, self-hatred, not knowing if you can trust your instincts because at one time they didn't serve you well or they served you too well. And I think it's kind of like what happens when you grow up and you're trying to establish a sense of reality, but that actually is not reflected back properly. And so you don't know really exactly where reality lives and where you live in relationship to it.
Mm-hmm. What an amazing way to describe that, because you went beyond what, if we look at what the books say, they just basically say repeated exposure to interpersonal trauma I mean, it's kind of talking about the nuts and bolts, but I really liked how you said that it, you said something like that the trauma and the personality.
They start to fuse.
Yeah.
And I'm not saying that in such a way where I'm describing this as a personality disorder. I'm not like really into the whole of the diagnostics of it. Um, but it can feel like, where is this voice coming from as I hear it in my head? Um, how do I perceive my body? Where did I get that information from? It's sort of like the most basic ways that we're in relationship to ourselves and others becomes infiltrated by the early repeated complex trauma.
Mm. So when you're talking about this, I'm actually thinking about someone I've worked with who, and you had brought up that you work with queerness and that community as
Yes.
well. So I think this really overlaps with everything that you focus on. Where we've been doing work around her trying to figure out who she's angry at. Is she angry
Hmm.
at her caregivers, her parents, or is she angry at herself? So there's this first tier where it's with the complex trauma. I notice, at least personally in my practice, and I'm so curious what you think, where there is this difficulty of discerning between who am I having these strong emotions towards, especially because I don't know if you've noticed, but I certainly have with complex trauma that the survivor almost feels guilty for having any feelings towards the people that inflicted the trauma, at least
Yes,
early
of
on in the
course.
healing process.
Of course. So, in terms of like caregiver relationships and this survivor, the CPTSD survivor,
It is hard to say. I was clubbing over it when we were chatting before we got going.
it's complicated because we sort of throw ourselves under the bus in the service of maintaining the attachments with our caregivers.
Mhm.
And it makes it really hard to know who to be mad at, right? Like things feel really bad. Why do they feel really bad? If you go towards your caregivers, your environment, whatever the case may be, then you're really at risk. You're like, wow, there's nothing safe. If you turn it inward, you're like, maybe I can have some control over this. The shame actually operates somewhat protectively because it keeps you from being enraged with your caregivers. And it's a way of maintaining attachment, which is what we need most. So the attachment we'll let go of first is the one with ourselves. And then when we hopefully start to do the healing work, we can rebuild the attachment with ourselves through the therapeutic relationship in a way that allows us to be angry at the caregivers. Like anything that starts to become external and is like no longer like plaque and residue in the mind of the survivor, I think is progress.
Mhm. I really love how you mentioned the relationship with the therapist because that's something. I don't know if you've had this experience where you have someone that you work with who's experienced trauma and they want to do, quote, the trauma work. And I
Yes.
think in their mind, they're thinking, okay, I know you do like brain spotting and EMDR and let's get to it. Let's expose, let's write journals, let's like do
Yes.
the kind of quote
Yes.
things.
Mm-hmm.
Whereas I don't know how you like work in your practice. I tend to work with people who have trauma for a
Yes.
very long time. And I read once a statistic that
Decades.
and I mean, I think my longest one right now is about 15 years.
Mm-hmm.
And you start to see them through different like phases of life and, things evolve. But I read once that 3 to 5 years is the average minimum for
For
complex
how
trauma.
long somebody needs to be exposed to trauma to develop
No, to be in
CPTSD?
therapy. That's like the
Oh, okay.
minimum.
Okay.
Yeah, the
2 to
average
5
minimum.
years.
Yeah, which still 3 to 5. That sounds like such a range.
Well, for me, I mean, to be honest with you, the majority of my treatments are probably a decade plus,
Mm-hmm. What
meaning
kind
I've
of
been
treatments
seeing
do
the
you do?
majority of my clients
Yeah.
for 8 to 12 years. Um, and there's some where I see progress like this week,
Yeah.
but building the relationship and the ins and outs of the relationship and being sort of the object and subject in the relationship takes so much time.
Mm-hmm.
You know, the unconscious doesn't keep time. And so
Point.
time frame that like equals anything, if
I
that makes
love
sense.
that the unconscious does not keep time. And
No
that
idea.
actually
Could be
doesn't
yesterday.
it lines so perfect with somatic work too. If you think when
Yeah.
we store things, it's all implicit. It's all kind of quote felt sense and there is no linear nature to that.
Right. There
Yeah.
is no, it's sort of like I have a client this week who's
Hmm.
experiencing a hip injury. It's completely like random. It's not like
Yeah.
something bad happened. And the way that they feel out of control, they might as well be like 2 years old, like begging to be picked up out of their crib, and nobody's coming to get them. And it's like, who am I in session with? And I often think, well, like many versions of the client, but this 2-year-old right now wants to know if I'm here enough to take them out of the crib and sit them down in a chair and make them feel comfortable. And obviously that's metaphor. I'm not picking anybody up. Um, but I try to
Extra special
imagine,
therapy.
yes, I try to imagine like, why is this hip pain in the here and now
Hmm.
calling on every ghost that's ever been here? And it's just like, there's no clock.
Yeah. Hmm. Well, and it makes sense too. I kind of think about not to reduce us to a dog, but I'm thinking
Sure.
of my dog, not Lenny, the crazy one that everyone knows from the podcast, but the one that I had prior to having kiddos. He had a knee issue. I had to get one knee fixed, and the other knee, it was the whole thing. And I remember before his knee injuries, he was just a super chill dog. And then at the time where he was feeling most vulnerable physically, he was so defensive. I got to the point where I couldn't take him to the dog park for a while because I was worried that he was going to lash out and,
Sure.
start a fight
Sure.
or something.
Yeah.
And I mean, we're really not all that different when we're feeling, especially physically vulnerable.
Hmm.
Even if you've spent all this time in your trauma work,
Hmm.
it's one less way to protect yourself. So, I mean, it makes sense to me.
Yeah. I mean, to be honest, like I have a dog who I would say is like the story of an attachment wound.
Really?
He,
How so?
yeah. Well, he was rescued from the border of Texas and Mexico. He was like, we got pictures of him and he was like covered in fleas and filth and like somehow got escorted to New Jersey, came to Philly, lives with me. Um,
Like what is it? The American Tail with the mouse, but like with your dog.
yeah. And it's like when he first came into my life, he couldn't even walk on a wood floor. He
Oh,
comfortably
wow.
walks on floors now.
Hmm.
He is insatiable around our attachment. And like anybody that comes near me, he sees as a threat. So it's like there's this progress, right? He can walk.
Right.
That's pretty significant. Does he feel that other people are coming to get me and take me away from him? All the time. And there is really, on some level, for me, a lesson in the limitations of the work.
Hmm.
Does that make sense?
I'm actually curious when you were saying the insecure attachment. Attachment wounds are so common with complex trauma. If anything,
Yes.
it's probably one of the most common symptoms of complex
Yes.
trauma. If
Yes.
someone's listening and they feel like, for instance, I can think of a client I'm working with who kind of swings between, she's definitely disorganized because she swings between insecure and avoidant, depending on the relationship, which I explained to her is normal, right? We don't have static attachment. It depends on who we're attaching to. If someone's listening and they feel insecurely attached, they feel flooded, maybe physically flooded or mentally flooded when the thought of the person not calling them back or being available
Yes.
happens. Like,
Yes.
what do you think actually helps?
In terms of self-soothing, in terms of the insecure attachment,
Any of
you
it?
mean?
Just for
Well,
someone
I
listening.
do think we need to like be able to first of all name insecure attachment and that it's a long-term symptom that is associated with having had trauma that was complex. And I think the word complex is really important. It wasn't simple, it wasn't straightforward, it was probably involving co conspirators. meaning like sets of parents or family or whatever the case may be.
Right.
And when you develop an insecure attachment, it makes you feel like if somebody is out of sight, they are out of mind and they cease to exist, right? We've kind of like failed at our capacity to internalize another.
Mm-hmm.
And I think there's a lot of self-talk around that in terms of like, this is the past making itself known in the present. This is a phone call. It could be any reason why this person isn't calling. But honestly, the treatment for it, I think, is like the secure attachment in the therapy over years that helps restore the capacity to know that everybody's not going to disappear.
Right. Mm-hmm.
Like,
And I
I
mean,
can't think of something else that does it.
yeah, I mean, well, and I can think of, if we look at all the theories and all the ways to process and all of this, I think there's definitely value in that as well.
Yeah.
Um, but I agree with you in the sense that, let's say hypothetically I'm doing, some sort of adaptive processing with someone, like we're doing EMDR or something like that. And so you've moved the memory and it's, reorganized and a little bit easier to understand.
Yes.
And you feel organized in that moment. But then you go out to
Absolutely.
the world and something happens. Like there's a rupture in a relationship, someone breaks up with you or something along those lines. That is a huge demand to
Mhm.
to take what you did in a safe scenario in like a therapy setting and then translate it into the world.
That's true. It's a really huge demand. And you're hoping that the therapy is like kind of building up over time the sense of resilience that somebody can feel in the world, right? If you keep coming back to something every week that's a predictable container where somebody is here and willing to see you, hopefully that, has an impact in that it's what we didn't have. Those muscles of trust and fear and all of that stuff kind of get built and stamina grows for relationships. But I mean, you're right. Like you leave a therapy room and what's going to translate. And
Yeah.
some of it is just telling our clients like it's really hard out there. It like attachment is hard. Everybody's attachments are hard. There is no one-way story about attachment. Like it's not just us. Everything is co-created and it's hard to understand what's going on for the person that we're in relationship with and why that might be triggering stuff with us. People typically with insecure attachments are really drawn to people who are avoidant and they
Why do
stay
you
in the
think that is, by the
repetition.
way?
What'd you say?
Why do you think that is, by the way?
Because they need to stay in the repetition of the chase of being like, if I become good enough, this person will love me, which mirrors their early childhood experience, which recenters them as the problem instead of the person they love or instead of the world not being safe. So it's kind of like there is a repetition compulsion to make us be the ones who are insecure, uncomfortable, expendable. And once we start to feel like, actually, if somebody didn't call me back, I don't actually want to talk to them, you're starting to enter like a sense of self, a sense of worth, a capacity to establish boundaries.
Mm-hmm. What
But I
about the
just
other?
want to
Oh, say,
go
keep
ahead.
going. I love it. Go for it.
I just want to say that like the thing about insecure attachment and complex trauma is like these are very serious issues. Like these really deplete what it's like to live in the world. And I don't feel like clients are given enough time and space to really absorb the grief of just how hard this all is. Like let's say we're therapists. We are therapists.
Shocking.
Right.
with
Like
with 2 decades each of experience.
exactly. Like I have this early like childhood fear that I'm gonna have a birthday party and nobody's gonna come. And
Oh,
when I started practicing, I was
yeah.
like, how do I know if anybody's gonna come to session, right? Like they become
Oh,
interchangeable fears. And then I'm the one who's like too attached to the clients and I'm not moderating the attachment properly because I'm like,
Yeah.
you're here for my birthday. And like to move into a place where I'm like, actually, you're a therapist with a role that, needs to
Yeah.
have a moderated level of attachment took so much time. Like, and I don't think it would have happened had I not put in the work to just keep going and like
Yeah.
being in therapy and being in supervision and helping me to like understand that this is not me as a child. This is me as a therapist, as an adult who's here to offer something consistent and reliable. And I'm monitoring myself the entire time, which typically having to do with CPTSD, the adults were not doing,
Mm, yeah.
you know?
I really love that because I think that's advice, and I know we're not here to like impart advice, but ideas, but that is advice that I have not heard really put that way about insecure attachment with complex trauma, where a lot of times it's okay, so go out, find a relationship, be in quote relationship and practice this in relationship. That's where you heal it. And that sounds really um I mean, it sounds rational, but sometimes that's really not possible. Like it's
No.
really not possible. So you just brought up something that works well that I've seen this too with clients. Like I had this one client who really struggled to speak up for themselves just in general. A lot of things in their life they were backpedaling on. Like they would say this is something I want and then someone would fight them on it and they would just instantly backpedal. And then they got a co-manager position at their job with a complete jerk. Like
Hmm.
this guy who was above them was just a not a good human being, honestly.
Right.
And at the beginning, we were looking at it as, "Oh, no, like, this is like, oh, you had to deal with this guy," and but as time went on, and a year into them working together, I actually told my client at one point, I said, "I am so glad you worked with that guy," because
Yeah.
what it did was it gave them an opportunity to flex the muscles and get the experience doing the thing. So it was in a
Yes.
very uncomfortable scenario, but then obviously with support that they got a new story told to themselves. They didn't
Yes.
even realize they were doing the thing that they were struggling so hard to do because they were so focused on their goal or their task.
Right.
So, yeah, and it kind of makes me think of what you're saying with like my goal is to provide therapy and
Yes.
that's what I'm going to do.
Right. But also, this person got the benefit of being exposed to a bad actor that didn't mirror them and they saw
Yes.
themselves as different from. And
Good
that's a
point. Very
huge
good point.
opportunity, right? There's, with our own caregivers, it's pretty easy to see ourselves in them, right? Like we came from them.
Yeah.
We get into the world and we're encountering a bad actor and we have to be like, this actually is just not me.
Yeah.
Like, I can't find it in me. I will not accept the projective identification of it because there's no place that it's landing. And establishing that individuation from whoever that bad actor
Yes.
is part of the development of the self that will then like be able to set the boundaries.
That is so amazing. Like I am so excited to take what you just said and apply that with my clients, honestly.
Cool. I'm so excited
I'm
too.
really excited because I think about how I talk with people all the time about individuation and I've never thought about the fact that let's say if it's even a bad actor who you do over identify with, maybe they're in your family.
Hmm.
I wonder if instead of it just being focusing on love yourself, be yourself, understand that they hurt you, like individuate in that way. But what if you spend a little time, and this is for anyone listening, trying to identify the ways you're not like that person?
Right. Right. That's huge. And naming them, taking the risk of saying them out loud, like,
Yeah.
I actually know that I wouldn't do X, and I actually know that I wouldn't do Y. And starting to name those pieces of the self as in contrast to others, and that's how the contrast has been shown to us.
Yeah.
Like, you run with that. That's huge.
I could see that also helping to build the sense of self because I think people get a notion where they have to build the sense of self only with good attributes. And it's true. But
Mhm.
sometimes finding the contrast, like, well, I know this about myself because I'm not that. which probably relates really well. Have you ever noticed people in work sometimes tend to tell you what they don't want instead of what they do want?
Oh, yes, I am well aware.
Like all the time.
Hmm.
And I mean, I
Hmm.
think we all kind of have that negative bias where we tend to do that when we want to make change. Not that it works that well, but so I want to, if it's okay, can we flip this really amazing thing you did with insecure attachment to avoidant?
Sure.
You said that avoidance and insecures tend to attract to each other, which I've
Yes.
seen often.
Yes.
Why do you think the avoidance
Oh, are
um,
looking for the insecure
are
attachment?
looking for the insecures? And I just want to give this one extra layer to this. I see avoidant as a very skilled defense mechanism because it really
Absolutely.
turns you into Teflon in a lot of situations where things will
Yes.
bounce right off you. So I'm
Right.
not saying avoidants are just these like jerks who ghost you, but if we look at it from the lens of it being a skill, why do you think they're attracted and what do you think avoidants need? Because we talked about what insecures need, and maybe it's the same thing. So I'm so curious your thoughts.
Well, they're here to save each other, right? Like that's the beautiful bottom line of it. For people who are avoidantly attached, the vulnerability has to live somewhere. And typically they pick somebody who will store it, hold it, overachieve at it, right? Like the
Yeah.
vulnerability is like spilling out everywhere.
Uh-huh.
And it's like regulating them that they're in proximity to vulnerability, but not actually having to feel it themselves. They're seeing
Yeah.
it being felt in the service of this like dynamic.
That's a really interesting thought. I have never thought of it that way. Could you
Yes,
give an example of what that might look like?
sure. Let me think for a second. So there could be somebody who is avoidantly attached, meaning that there's probably like a persistent drive for autonomy. There's a feeling like if I don't have an exit plan, I'm not going to be able to stay in the relationship. There's a lot of like dehumanization that goes on in the avoidant person's attachment to the other. And yet they're still a vulnerable, complex person, right?
And what do
So
you mean
where
by
does
dehumanization? Because I lost you on that one part.
well, avoidantly attached people can dehumanize their partners very easily, right? They're basically like sitting there saying like, I could take you or leave you, or you're
Oh, I
bothering me.
gotcha.
Um,
Or
I
like
don't
if you
need
don't do
this.
blank, then it's over. Like a lot of
Right,
that. Okay, I gotcha. All right.
right, right. And then the partner can start to feel like, am I just here for like utilitarian reasons? Like, what's really going on here?
Mm-hmm.
But the thing about the person who's avoidantly attached is that they're desperate to be attached.
Mm,
And they meet somebody who holds that desperation for them. It's like a projective identification or a projection, kind of different. Um, and then that person does that work.
for them.
Yes. And then for the insecurely attached person, right? They
Yeah.
want to be like a barnacle that like is here for stuck on this dock for the rest of its life. And
Yeah.
at the same time they don't want to be a barnacle. And you can't be a barnacle because you can't swim anywhere, right? You're just stuck on a wall. So
Right.
both defenses are sort of serving each other
Mm-hmm.
problematically, but
Right.
to achieve some sort of homeostasis.
Okay, that makes a lot of sense to me. And when you were saying the barnacle that doesn't want to be the barnacle, it makes me think of in my ADHD group last week we did. Have you ever done Gretchen Rubin's like 4 tendencies quiz?
Yes, but
It's
it's been
it's
a while.
it's cute. I like it. It's fun. It's a fun way to open up conversation. I prefaced to everyone this is not a diagnosis. It's just we were talking about motivation. Let me tell you that of my 12 women who were there that week, we kind of waver between 12 to 20, depending on who remembers to show up. I'm just kidding. I kind of giggle at like a bunch of ADHD women come in a group.
Of
11?
course.
Was it 11? I think it was 11 were obligers.
Wow.
Almost every, yes, which got me thinking, I got to research this more and look into this a little bit. But what struck me was the amount of them in the group who were not happy about it. who were like, well, I don't want to be an obliger. And then we talked about the connection between rejection, sensitive dysphoria, and obliging and all of this and, all the redirections they get. That's a whole nother episode. But it struck me the anger that came out. We were talking about working with your tendency, and maybe something we could chat about in another episode. But that really relates to what you're saying. Like, they're a barnacle, but they don't want to be.
No, they really don't want to be. And the avoidant person doesn't want to be. And none of this is aligned with our healthier instincts. But the trauma cuts us off from that and puts us in varying kinds of survival modes, whether that's an anxious attachment or avoidant attachment or a disorganized attachment. And we're just sort of like living with it. And it's hard to even articulate what's on the other side, right? Like, is it going to be possible that one day somebody who has been horribly meshed with their mom isn't going to worry that their mom's dead? I don't know. If you start to think, actually, I am going to have that thought every day and it's going to pass. It's part of me now.
Right.
And hopefully I can like get some control over my heart rate and my physiology around it. That's the goal. But is the thought that this person's going to die going to go away? No, probably not.
And I think that's probably where the marriage between the relationship piece that's so crucial that you're talking about, and maybe some of those processing therapies and somatic therapies make a big difference.
Right.
We talked about what an insecure attachment person can do. Is it the same for the secure? Not secure. The avoidant attached. Like, if they need to figure out how to heal and, I guess, be comfortable being vulnerable. For the insecure, we talked about finding their sense of self by understanding that you are not the bad actor. But
right.
Avoidants are not usually the bad actors. In a lot of ways, I don't feel like all avoidants are avoidant in all areas of life, because if they were, they would be, just up. In general, I just can't see it being in general. They would be avoidant with all relationships. So I'm curious, what do you think?
It is actually pretty consistent.
You think?
But no, I wouldn't describe it in an all or nothing way. I think what you're sort of naming, like, do you know the term egosyntonic versus dystonic?
I've heard, I genuinely, I've heard it like forever ago, but you have to refresh me on that.
I'm like going way back.
No,
so
dig out.
So somebody who experiences symptoms as egosyntonic, meaning like those symptoms are working for them and working with them, are less motivated to change, right? And people who have avoidant attachment styles, that's egosyntonic. It's sitting okay with them. It's working. It's keeping them somewhat protected. It can't last forever that you just put away the desperation of wanting to be known and seen. For some people, actually, it can, or they need like, midway relationships where the person's near but not necessarily living with you, whatever the case may be. But for people who are insecurely attached, it's dystonic. It does not sit well. So you're already coming into the treatment in enough distress that you want to make the change.
Gotcha.
The people who are avoidantly attached, to get to the loneliness is like, that's the work of the treatment, and to
get to the
know that that's okay. Yes.
Okay. So if someone's listening and they more identify with the avoidant attached type, how do they, I wonder if they even register loneliness, because I feel like that is a really complex emotion to separate from things like anger and annoyance, and you know what I mean? Like, it's almost like digging beneath all the dirt and you're like, oh, there's loneliness.
There's like this horrible pain, that usually tries to become masked. In perfectionism, people pleasing, well, I don't know that every avoidant person is interested in people pleasing, but basically the wish to connect gets masked by symptomatology and defenses. It does not leave though. And as therapists, we're responsible for remembering that fact, that everybody does actually have a wish for connectivity, at
Hmm.
least at certain points in their life.
Yeah. So when I think of the ego dystonic, you were saying, is when
Hmm.
it's not working for you.
Yeah.
And I guess that makes sense, like symbiotic and
Yeah. Yeah.
all these Latin roots. But
Yeah. Yeah.
I could imagine if someone is avoidant and they feel like this is working in all areas, it might be beneficial, whether it be in therapy or whether it be through your own self work, to take a more honest look at all of the different areas of your life. Like maybe it actually feels like everything is working well, but it's not normal to fight with your partner every single day about connection, for example.
No, it's not.
Right. And so maybe
And
that's
it's not your
something.
partner you're fighting with.
Can you elaborate?
I mean, we're in relationships with our ghosts and with the person who's right in front of us simultaneously, and we get confused.
Hmm.
What is being brought up by the partner is not necessarily what the partner's doing, but triggering a whole host of other things. And so part of it is to be like, is this really about the here and the now? Or is this my past making itself known in the present, along with this other person's past making itself known in the present, in
Hmm.
addition to also the present making itself known in the present?
So when I think of what you're talking about now, that seems like something that happens really commonly with complex trauma, though, because the let me wait and see if someone proves me right kind of energy is really common. Like let's
Mm-hmm.
see if they screw me over. Let's see if they break my trust.
Yeah.
Yeah. What are your thoughts on
What's
that? Yeah.
Well, I think that we're constantly studying, and some I read, I think even yesterday, that part of what somebody who has CPTSD does is study relationships rather than enter relationships, just to
Oh.
see what the dangers are, how they
Yeah.
can keep themselves safe,
Right.
to figure out a plan around hypervigilance if this relationship's going to hurt,
Hmm.
to almost be taking notes about what to do and what not to do to not evoke the same pains that they've experienced in the past. And part of what we are hoping can happen is that somebody can attach with the person in front of them without history sort of blocking our access to what's happening.
I really love that because it makes me think of clients I work with who there's one in particular that comes to mind who has been desperately dating. I'll put it that way.
Okay.
Desperately dating over the last 6, 7 years. Almost like a part-time job, honestly. The amount of, relationships, not even relationships, the amount of dates and people. I need a geneogram or something to, like, keep up with
Mhm. Of course, of course.
all the different people that she's gone on dates with, and she is, absolutely not entering. Like, that's such a good way of putting it. It's almost
Right.
like she's there. I think there's a difference between date around and see what you like and figure out who's a good fit for you
Mhm.
versus it's almost like a self-study to your point of like,
It's
okay,
like
so
checking books out of a library.
yeah, I've never put it that way.
Yeah.
So if someone is doing that, then it feels to me like the only option is to enter in. So how do you tell someone who feels like it's unsafe, like, to do that?
Unsafe. Okay, how do you tell somebody who feels it's unsafe to enter a relationship rather than study a relationship?
Yes.
I mean, I often reflect like, I don't feel like you're taking that many chances. I don't think you know this person well enough. I think you're collecting tons of information that is not serving you and also does not paint the picture of a complex other. Um,
Mhm.
And I often will use like my relationship with a client. Like in this moment, I don't actually feel like you're holding all the dimensionality of me. Can we look at that together? Because I think I might have a sense of what's going on out there based on my experience in here.
That's really interesting because that particular client I was bringing up, and I have been very upfront with her about this because anyone who works with me knows that I put myself in the room as part of the
Right.
relationship. You probably read The Gift of Therapy by Yalom.
Yes, of course.
Oh my gosh. Like literally one of my favorite books. It's so, quote, I guess old in the field. You were saying 20 years. We can't say that's
Yeah.
old. And I recommend it to all my students, even though it's not
Mhm.
part of the
It's
curriculum.
beautiful,
It's such
beautiful.
a good book, and it just gives you permission to bring your humanness as the
Mhm.
therapist into the room.
Yeah.
And so I remember with that particular client, me letting her know where I was at with her, that I've been working with her for 10 years now. I know things factually about her, but sometimes I still feel like I don't fully know her.
Right.
Yeah.
Yes, exactly. And I
Hmm.
think that's when you're like, can you tell me truthfully when you look inside and you do a self-scan, is there vulnerability here? Or are you thinking, I'm going to do this session, I'm taking in what's being said, but I'm going to make sense of it when I've left the relationship and when I leave the room? Because I would love it to be able to happen between the two of us, right? And there's clients who are like, yeah, I hear you. I hear you for sure. And like things you're saying are resonating,
Hmm.
but they're not impacting the moment.
Hmm. Yeah. When we're talking about the avoidant person feeling comfortable being vulnerable, and I think I've been using the word safe. That's a very loaded word. I know that. Something that comes to my mind is that I've had folks say it just feels uncomfortable or unnatural. Like it feels uncomfortable to say I love you, or unnatural to, even hug for long periods of time, or just anything like that.
Yeah.
For someone who is avoidantly attached, and this
Okay.
probably also applies to insecure attachment too. Basically anyone who does not have a secure attachment. We've used the word safe a lot,
Okay.
be loaded. But I think another way that something can feel unsafe is just being uncomfortable. Maybe
Okay.
it feels uncomfortable to say I love you, or uncomfortable to connect or share or even make eye contact. And that's separate from neurodiversity. I'm not saying,
Yes, totally.
that
No, I
that's
completely understand.
a different area that I have to now. This conversation has been so awesome and took such a turn that I told you I wasn't going to prepare, because
Yeah.
I love all the stuff you talk about. I wanted to see where we
Thank you.
went organically. So I'll have to have you come back to talk about neurodiversity for sure. Um, but what would you say to the discomfort? It might not
Okay.
feel like a 5 alarm bell, but it just feels very uncomfortable.
Right. So, one question we have to ask as therapists is like, what's wrong with discomfort? Like,
Hmm,
what's going to happen?
good
Are
point.
you going to survive it? Is it going to kill you? Let's differentiate because there's a whole spectrum of discomfort, right? And there's lines that you want to be sure don't get crossed no matter what the case may be. But on the other side of discomfort, like just say you're training for a marathon, is a thrill,
Hmm.
and you've made the plan if you're running the marathon to feel discomfort for the duration of the training. And you're doing it all to get to a finish line, probably not even first, just to feel like you
Yeah,
accomplished
just
it.
get over it
And
all.
it's like we can't get away with fulfilling experiences without knowing that there's going to be discomfort in our lives. We can't manage our lives in such a way where discomfort is something we try to avoid. Like we live alongside of it. And the expectation of comfort, I think, is one that's worth examining through the lens of privilege. Um,
Hmm.
and also, it is there ever comfort, right? For the people who are frequently uncomfortable, like they're uncomfortable hugging, they're uncomfortable saying I love you. Like, is comfort there in the absence of not hugging and not saying I love you? I don't think so.
Oh my gosh, what a good point. Because
Right.
maybe there's not discomfort, but the absence of it might be where things like distraction, addiction, other ways to
Right.
fill it,
Yes. We're choosing our
torment.
discomforts. Yes. I mean, not necessarily consciously, but
Right.
there's nothing, like, honestly, right now in the world that's particularly comfortable. And I feel like, I don't know where you're located. Where are you?
Raleigh, Durham area,
Okay. So
so
I'm in
North Carolina.
Philadelphia and
Mhm.
it's been cold for 2 full weeks. Like
We have had the kids out of school for basically that
right.
because we can't handle ice, which is valid.
But it's like it's uncomfortable.
Yeah, it's
And what
true.
are you going to do? Not like be in it? I mean, this is the temperature today.
Yeah,
And hopefully we have the jackets, the scarves, the hats. That's part of the stuff we start to acquire in therapy. But
yeah.
ultimately, like, there's a way in which we can't warm up. And like, we can't remove ourselves as a result of that.
hmm That's such a good way to put that. And I think for anyone who listened today, I hope that you took that there are ways to continue healing, but it's definitely not. You said the finish line. The marathon is your whole life. but you're
And there's
heading
discomfort the whole
towards,
time.
yes,
Yes.
discomfort the whole time. I sometimes relish in moments of contentment because I know that they're fleeting. But
Mm,
I
that's
I like
profound.
it because you know what? I'm going to ask you this one last question because I think this is a slightly controversial question in
Mm-hmm.
our field that would be the
Mm-hmm.
cherry on top of our conversation because I want to hear one of your like, this is what I think we're getting wrong. Because I think that's your thing. If you were going to have a thing, that would be your thing.
That's helpful. Thank you
Yes,
for that
that would be your
reflection.
thing. Hashtag what we're getting wrong. But I've had people who have different opinions on whether or not you can quote heal PTSD.
Uh-huh.
What are your thoughts on that? And what are we getting
I
wrong
think that
about that?
the word heal is really aspirational and also seemingly finite. It doesn't suggest that there's an ongoing and nonlinear fashion to how everybody's life
Good
gets
point.
lived.
Yeah.
Um, I think more about easing than healing.
Oh, I like that. Okay. Yeah,
And
because it's not like a cut. A cut scabs and then the scab falls off and then you
right,
might have a scar, you might not, but there's a linear fashion to a cut healing.
yes, absolutely. And it's just like we have ups, we have downs. We hope to find more ease in our life by having like a mastery of it, understanding ourselves, understanding what's ours, what's somebody else's. Um, the idea of healing from trauma is almost like similar to the weather, suggesting the weather will stop.
True.
It
Yep.
literally never will. Like, it's
Yeah.
every day there's a new report on the weather, right?
Right.
And the question is, how easily do we accommodate to it? How badly do we react to it? And also knowing some days it's just beautiful and warm.
Mm. That goes so well with your analogy from the snow that you've been having in Philly because it's like if you're in the work, whether it be in therapy, whether it be all the self-help, the spirituality, whatever your avenue is, that's the coats and the hats and the
Yes.
ice and the shovel that I should have had at my office. Um
I should have had headphones in mine.
Oh
So,
my gosh. Well, we had to chip away at the ice block that was in front of my like physical private practice office last week. But
right,
those are the tools. Those are the things that make the weather more manageable. And
right,
so I don't want anyone listening to think that this is a pessimistic view of trauma. It's actually a quite empowering view. It's saying you can't change your past, right? This validates that because I
right.
think a lot of people feel invalidated when they have an uninformed healer or helper say, well, this is the timeline of when you're going to be done with this. I
It,
think that's
it's just
very,
totally fictitious.
I agree. But I think it can also feel kind of hopeless to think, well, am I never going to get through this? But if you change your perspective to what you were saying today of how do you ease it? How do you have the coats and the hats and the tools so that when the weather turns or when
Mhm.
your hip hurts or when you experience a loss or a transition in life, you've got those things ready. I love
Yes,
that. I
yes.
have to have you back, Dana. Like I just
Oh,
I
anytime. I will bring the best headphones you've ever seen.
I knew when I saw the things that you talk about and how you talk about them. I was like, I am going to enjoy this conversation, and I really did. So
Yes.
yes, and for anyone listening, you do have some exciting news. I know you have. Oh, is it a workbook coming out?
Yes, I have a workbook around creating accommodations for yourself as somebody who is neurodivergent, kind of like a self-care, self-guide journal that helps you name what feels like an obstacle in terms of your functionality, what would feel like an accommodation. And I'm also hosting something on working with neurodivergence on February 27th. And there's like a link to that in my Instagram, and
Okay.
you'll find it.
Well, we will also share that in the show notes. And for anyone who wants to find you on Instagram, or if you'd rather them hop over to your website.
TikTok's probably the best bet. I don't know. I'm like sort of
found you because TikTok stresses me out and I'm not on there.
Okay, that's good to know too.
A while ago, but
well, I'm glad you did find me.
Awesome. Well, thank you so much for coming and joining us. And stay tuned. We will have to have Dr. Danna back for a neurodiversity conversation. So be well,
you tell
everyone.
me then. Okay, bye.